Good afternoon. Thank you for joining us for today's ASPPH Discover Public Health webinar, Environmental and Occupational Health, featuring Dr. Mark Robson, Professor of Environmental and Occupational Health at Rutgers University, and Dr. Michael Bossesi, Interim Chair and Associate Professor of Environmental Health Sciences at The Ohio State University. This webinar is the first of the ASPPH Discover Public Health webinar series, which has been designed as a service to CEIF-accredited ASPPH member schools and programs of public health. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the chat or question box. We will address your questions at the end of the presentation. Please be sure to refrain from placing your line on hold during the webinar. This webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Our speakers today, Dr. Mark Gregory Robson and Dr. Michael Bossesi, are leaders in the field of environmental and occupational health. Dr. Mark Robson is the Dean of Agricultural and Urban Programs, Professor of Plant Biology and Pathology, and Professor of Public Health at Rutgers University. He has an MS and PhD in Plant Science and an MPH in Environmental Health from Rutgers, as well as an honorary doctoral degree in Public Health from Chulalongkorn University in Bangkok, Thailand. Dr. Robson teaches classes in agroecology, health safety and the environment, environmental health, and global health. He leads the extension efforts for vector biology and is responsible for part of the Urban Agriculture Initiative at Rutgers. Dr. Robson is also a recipient of the 2009 ASPPH Pfizer Award for Teaching Excellence. Dr. Robson's research is on health effects exposures to pesticides in developing countries. He is currently the PI for Science, Technology, Research, and Innovation for Development, or STRIDE, a USAID RTI Rutgers partnership. The STRIDE program is a 5-year initiative by the USAID that aims to strengthen applied research activity in Philippine universities and industries. Dr. Michael Bossesi is currently the Senior Associate Dean for Academic Affairs, Director of the Center for Public Health Practice, Interim Chair of Environmental Health Sciences, and Tenured Associate Professor of Environmental Health Sciences in the College of Public Health at The Ohio State University. Dr. Bossesi earned a PhD in Environmental Science from the State University of New York College of Environmental Science and Forestry in association with Syracuse University, and an MS in Environmental Science from Rutgers University. Dr. Bossesi is an environmental health scientist, board-certified industrial hygienist, ABIH diplomat, AIHA fellow, and registered environmental health specialist. His primary scientific expertise includes assessment of human exposure to and control of toxic chemicals and pathogenic microbes, applied environmental toxicology and microbiology, and hazardous material and emergency incident recognition and response. Thank you for being here today, Dr. Robson and Dr. Bossesi.
Thank you for having us.
I'm going to turn it over to you.
So let's begin. First of all, we'd like to thank everyone for participating in the webinar, one of the first in looking at careers in public health. And Dr. Bossesi and I like to think, of course, the most important and most interesting of the areas, environmental health and occupational health. And, you know, it's exciting that the WHO defined health way back in 1948 as the complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. But what's interesting is environment didn't come along until 1995. So while we think of environmental health as being something that goes back to the time of the Romans and the Greeks, or in the Asian tradition way back 5,000 years ago, really the WHO and other folks haven't recognized this until fairly recently. So next, as we look at this, we want to use probably a good definition that comes from NEHA, the National Environmental Health Association, that talks about it's the science and the practice of preventing human injury and illness and promoting well-being. I think that's the important part about environmental health. It's just not measuring what's wrong and coming up with lots of numbers. It really is trying to go forward and promote well-being and to prevent further problems. It's very easy for folks to come in and take samples and tell you how polluted the stream is or how dangerous the air is. That's not what environmental health is about. Environmental health is the opportunity not only to describe the problem, but also to come up with some remedies and try to limit people's exposures and try to move forward in a very positive way. Now, one of the questions that people ask us, of course, is, well, if I choose environmental health as my option, next slide, what am I going to do? Where will I end up employed? Historically, in public health, especially for folks that came back for the MPH degree, a lot of folks were already employed. Back when I took my MPH, I was already a faculty member and working in environmental science and went back to get this terminal degree. Now we see lots of folks who are newly minted baccalaureate candidates, and they are wanting to get the MPH as part of the beginning of their career as opposed to later on. And so the question comes, well, after I finish this degree, where will I end up? And there's two broad areas that we can divide this up into in the government, either at state, local, or federal. And that includes health departments, departments of environmental conservation or environmental protection. And also at the federal level, things like the FDA or USDA or EPA. So there are lots of opportunities at the governmental level. In recent years, those have all become fairly competitive salary-wise, and in almost all cases afford young folks the opportunity for advancement. The private sector historically has been folks who are industrial hygienists, folks who are quality control, quality assurance folks, and folks who are worried about risk assessment and managing exposures to certain kinds of processes. In recent years, too, this has included healthcare organizations as well as consulting firms. The non-governmental sector, which is a part of the private sector, has become an opportunity more recently for folks in environmental occupational health, as we see more and more NGOs, non-governmental agencies, that have become more engaged in environmental and occupational health. Let's go to the next slide. I think the other exciting part about environmental health is at what level you can work at. We just talked for a minute about where the jobs are, but within that where the jobs are, there's also where you are. And environmental health is both very local and very global. And we think about that when we teach. We always talk about the fact that we have to focus on the environment, air, and water, and the subpopulations that are closest to the exposure. If a tanker car turns over in a small city in the Midwest and goes off the tracks, that's a very local health problem. At the same time, as we look at something that is hard to always grasp, like global warming, that's clearly a worldwide problem. Both of them, of course, have effects on populations, both locally and globally. Both of them are challenges for us. Both of them require science and trained professionals. So environmental health runs the entire gamut from very local, in your town, in your house, if you have an exposure, to the bigger global picture about carbon fuels, about increases in global temperature and other things. So we think that that's what makes global health exciting. Let's go to the next slide. We have that, we spend the time to talk about environmental health as really a specialty of environmental science. It's not uncommon for us when we look at applications for folks who are entering the master's or doctoral programs to come with biology or very often environmental science, especially if they come with some prior work experience. And so what Dr. Besessi and I like to remind people of is that environmental health really is a specialty of environmental science. It is all about identifying things, measuring things, looking at the fate long-term of chemicals, biological, radiological agents in several media, air and water, soil and food, and the pathway with which one is exposed. And you know from your interest in biology and also in risk assessment that whether it's something like the oral pathway through ingestion, or it's the dermal pathway, contact with your skin, or the inhalation pathway through breathing, that we have this very complex set of media. We have this complex set of exposures, and certainly at least 3 ways, if not more, that we can become exposed. Next slide.
So this slide presents a graphic that just is another way of representing one model to describe environmental health science and further distinguish the specialization from the overall umbrella of environmental science. So if you look at the first 4 boxes going diagonally from the top, sources to environmental agents to the matrices to distribution, if you were to look at that, we're looking at the sources of various contaminants, both natural and from human origin, and then categorizing among the agents, which I'll discuss in a little more detail in a moment. But generically, we can categorize them neatly into 3 categories of physical, chemical, and biological. And then looking at matrices, or said differently, where would we find these contaminants, either resulting from a source or the actual matrix is the source. And air, water, soil, and food are the most common ones that we talk about, but also various surfaces where there may be various building materials and so forth that may contain contaminants such as asbestos is just one of several examples. And then going further, trying to answer the question, where would we find these, and when we find them, what is the fate? How do they move into and through various matrices or media? Do they change due to some type of chemical or biochemical process or processes, or even some physical processes such as sunlight changing an air contaminant from one form to the other? And then how are they distributed? Is it through some inanimate object or vehicle, or is there some living organism, or all the above? So just looking at these 4 boxes and limiting it just to that, that is one way just to represent the overall umbrella of environmental science. And then certainly other specializations can come into play there: environmental microbiology, environmental toxicology, ecology, and so forth. But when you look at the 5th box, which says human receivers, that's what really distinguishes environmental health sciences from just the overall environmental science, because as Dr. Robson just mentioned, we're also interested not only in the origin of contaminants and the forms of the contaminants and the levels of contaminants, but answering that question, are there pathways to humans, humans being the receivers of these potential exposures, and then answering the question, if exposed, what are you exposed to, how much are you exposed to, and what is the fate? Next slide, please. So this graphic is just one way to look at the 3 categories: physical agents, chemical agents, and biological agents, and the subcategories within them. For example, under physical agents in environmental health science, we look at both sources of ionizing as well as non-ionizing radiation, other physical factors such as noise, and chemical agents, primarily toxic, inorganic, and organic substances. But it can also include other hazardous materials, such as those that are classified as flammable and so forth. But for the most part, the environmental health science model is looking at toxic chemicals, toxic physical agents. And then under biologic agents, we look at predominantly infectious agents or other modes of activity. And this includes mainly microorganisms as examples. But the key is answering the question, the pathways of exposure, the levels of exposure, the characterization of what people are exposed to, and estimating using instrumentation and or other approaches to modeling and epidemiology and surveillance activities to estimate external exposure, and then determine the fate thereafter: internal exposure, ultimate manifestation of acute and or chronic diseases, or even ultimately the impact culminating in death. Next slide, please. And so this whole model is appropriate and applicable to environmental health science in general, but when we use that word environment, we have several ways in which we can describe an environment, and we like to describe them as various environmental settings. So very generically, for example, we can talk about the indoor environment versus the outdoor environment, recreational environment versus non-recreational environment. And what you see on this slide here is another way of describing, categorizing environmental settings as occupational or workplace environmental setting, as opposed to the non-occupational environmental settings. And so there is a distinction between these, because oftentimes within a workplace setting, the environment may be such that there is increased specificity of potential contaminants or even actual contaminants, and the ability to characterize them within an isolated environment in association with very specific tasks. Whereas in the non-occupational settings, there may be increased combination of various types of agents, and rather than focusing predominantly on airborne exposure in the workplace environment or dermal exposure in the workplace environment, in the non-occupational environment we deal with a broader spectrum relative to modes and routes of exposure. So beyond airborne pathway and direct contact, we also more likely, in addition to those two, will have to address waterborne exposure, foodborne exposure, and so forth. Next, please. So as we look at environmental health science as a specialization under environmental science, you can go a next step knowing that there are different settings, and under environmental health science, or at the very least, if not under, in alignment with, you have the specific environment known as the workplace environmental setting, as I just mentioned, and as a subspecialty, there's occupational health, otherwise known as industrial hygiene. And very similar paradigm to environmental health in general, with increased specificity that the population of focus is predominantly the workers, and the sources are usually more well-defined. They're originating from the workplace. And so there's a broader tetrad relative to the approach, but very similar. We talk in terms of anticipating, recognizing, evaluating, and controlling various factors or agents that may result in exposure and therefore increase risk of initiating human disease. So again, occupational health or industrial hygiene is a subspecialty of environmental health science where the focus is predominantly on worker health. Next. And so these are just 3 photos looking at it from the perspective not only of workplace and various tasks. One is the food industry in the top slide. The other is a welding operation where there can be exposures, but it also shows 2 other aspects. So there's a potential source of exposure in each one of these photos, but it also gets into the aspect of evaluation of exposure. So you see monitoring instruments on the tank above the stainless steel tank. You see a monitoring instrument in the lower right photo of the individual. But you also see another component, and that's the control aspect of occupational health, in a control category of personal protective equipment. And in each of these 3 photos, you see the individuals wearing various types of personal protective equipment, such as face pieces that are known as respirators to help remove the airborne contaminants before they are inhaled, and all other types of equipment such as a Tyvek suit, that white suit, or a more coverage in terms of a chemical resistant suit in that yellow suit that's being worn. So that's another aspect of occupational health, and these represent 3 settings, 2 indoors, 1 outdoors, but also include the components of evaluation and control, at least control from the personal protective equipment. Next.
So what makes this so exciting in environmental health as a field, environmental occupational health, is the enormous range of opportunities, whether you're the health officer in your local municipality, whether you have a position at the state health department or at the federal level, or for the next few slides, we'll talk about the opportunities for you on the global scale. And WHO, a few years back, World Health Organization, determined that almost a little more than a quarter of global disease was caused by environmental exposures that can be averted, that we could really prevent. And of course, the way that we do that in all public health, as you know, is targeted kinds of intervention through education and training, and to try to do this with a thoughtful and practical sense. That's what makes public health so exciting, is in addition to the range of opportunities, we try to be very much practitioners and try to approach these things with as most of the practical mind as possible. It's pretty amazing that the World Health Organization says more than 1/3 of disease in children under the age of 5 are caused by environmental exposures. And if we could manage those environmental exposures, if we could prevent that environmental risk, we would save as many as 4 million lives a year just in the midst of the children. Most of this, of course, occurs in developing countries. In developed countries, we have quite a number of standards and we have quite a bit of protection in place. But do keep in mind that most of the world is still considered as developing, not developed. So let's look at the next slide. And if we look at the next slide, it's pretty remarkable. This is the population without access to safe water. And as you see in the Asian and Europe and the African continent, there is a pretty significant percentage of the population that does not have access to safe water. And of course, when we think of environmental and occupational health, we immediately think of air and soil and water and food as those 4 big matrices where we can have exposures. And those are the 4, sometimes you might say, rate-limiting steps for longevity. So let's look at the next slide and see that when we look at global life expectancy, again, data taken from the WHO, and we see on the African continent there is a large proportion of the southern half of the African continent where life expectancy is less than 40 years old. It's a pretty amazing statistic, and it's one where we know that in time it's going to continue to be a great global burden on the health system. Keep in mind that there are about 7 billion people in the world, and when many of the listeners are my age, and I'll be dead for a long time by that time, but when you're my age, there'll be 9 billion people. Every morning when you wake up, there's 250,000 more people that weren't here yesterday, which is a pretty remarkable statistic. So in 2050, we'll have about 9 billion people. So let's look at the next slide. So when we make the case for why environmental occupational health is important, we just looked at some of the graphics where we see that many of the countries around the world, particularly African continent and South American continent, are considering developing countries. 80% of the world's population lives in what is defined as a developing country. Now what's amazing is that while 80% of the folks are in developing countries, more than 80% of those environmental and occupational exposures are resident with those folks. So they have a disproportionate burden of environmental and occupational burdens. And those include some very traditional kinds of exposures like silicosis, lead poisoning, benzene poisoning. Now we have the advantage, or most of us, I'm assuming on this webinar, have the advantage of the 211 of us that are listening today, that we live in the developed world, where in fact we have risks that aren't necessarily new, but they're risks that we had 50 years ago. So as we've moved forward and had more controls, the risks that we see now in developing countries are not unlike the risks that people would have seen probably right before and right after the Second World War. Let's go to the next slide.
So as we've already mentioned, when we talk about where we find contaminants, we define them as matrices or environmental media. And air represents one of the primary matrices where contaminants can be suspended or dissolved. And it's also an example where we can categorize the environment as indoor or outdoor. When we're referring to outdoor air, we often call it the ambient air. And within that, there are various sources of contaminants, and those are categorized further as mobile sources, automobiles, various vehicles, and stationary sources such as factories and so on. And so one application of environmental health science is to characterize those sources and, again, determine pathways of exposure and levels of exposure primarily via the inhalation mode. Next. But there's also the indoor setting as well, and so whereas we have concerns and very real issues of ambient air contaminants, ambient air pollution in general, we also have concerns within the indoor setting and the air within those settings. So we have another focus area of indoor air pollution, where environmental health specialists will be involved in various capacities. Again, characterizing the air within facilities that is influenced a great deal by the quality of air from the outdoors, but also generated from various sources that are found within homes or office buildings and so forth, such as combustion sources, various chemical cleaners, and so on. So air represents one of the major matrices, and we characterize it both from outdoor air and indoor air. Next.
So let's look at another matrix, and that would be the one for water. And water is an interesting one. For the next few slides, we're going to give a little bit about why it's important as an environmental media. We're going to talk a little bit, I'm going to give some examples of some of the work that I've done to give you an idea of the kind of research that you can do. 71% of the world's surface is water, but almost all of it is salt water, about 97.5%. If you then have 2% in glaciers and ice caps, we have less than 1% of water available to us, and a large amount of that, almost 96%, is groundwater. Next slide. And so as environmental health scientists, next slide, as environmental health scientists, we want to talk about why this is so important, because we really do need water to survive. It's one of the most important environmental media that we have. And we wanted to go to the next slide. There we go. You and I forget that we're about 65% water, and in children a little higher. Our blood, which is pretty intuitive, is about 83%. Interestingly, people forget that bone is about a quarter of bone is water. And to keep our plumbing internally working well, we need about 1 to 3 liters a day just to maintain normal body function. Water is a finite resource. That's the other great challenge in environmental health. So much of what we work with in environmental health are things that really are finite, and while water in fact is renewable, the rate of renewal is very slow, and it's a very fixed rate. Let's go to the next slide. Our standard of living here in the developed world, we need about 100 liters of water a day for the daily kinds of activities that we do. In fact, when large municipalities are designing sewage and other infrastructure kinds of systems, they count on us using them at least 100 quarts, about 100 liters of water a day. Here in the developing world, the actual consumption rate, if you look at everything, is more like 200 to 400 quarts or liters per day. In developing countries, water is a very, very costly item. In a place like Haiti, for instance, a fifth of someone's budget is just spent on water. WHO says that if we were to improve water access, we could reduce diarrheal disease by about 25%. And if we improve both the access and the quality of the water, we could reduce it even further to about 37%. Next slide. So while the epidemiologists take credit for John Snow in environmental occupational health, we'll take a little credit for him too. And what a remarkable environmental health story it is with Dr. John Snow, who of course was a surgeon and anesthesiologist in London, and during the 1854 Asiatic cholera epidemic in London, he made very keen observations about the rates and the distribution of cholera in the city of London. He didn't know what the cause was, that it was the cholera bacillus, but he took prudent environmental health measures to remove the handle from the Broad Street pump. And let's go to the next slide, where you have the opportunity to see the distribution of the cases of cholera. And as you can see from the dots on the slide, they were focused around one particular pump. If you look up at the top of our slide where it says Oxford Street, those X's are each pumps or wells, and there the incidence of cholera is quite low, but the cases for cholera right smack in the center of the slide shows you this. And so he was truly a shoe-leather epidemiologist, but also quite a leader as an environmental scientist. Let's go to the next slide. So water is an important, oh, there's the picture of the pump. You can get to see it without the handle, of course. Next slide. Yeah, it's interesting, you know, back in the 1880s, typhoid killed about 100 out of every 100,000 people, and there were some famous, what you might call environmental disasters, environmental health disasters in history. In 1885, 90,000 people in Chicago were made very, very ill because of the Chicago sewage was diverted into Lake Michigan in the same area where the water intake was. Today we know that young people die of waterborne diarrheal diseases up into the number like 3 million. And these deaths are almost all associated with a lack of adequate sewage disposal facilities. So this is a real environmental health issue, and it was one that was historically a big problem in the United States and other parts of the world that are now considered developed. But in developing countries, this is still an enormous issue. And let's go to the next slide. This is not an uncommon sight. I took this picture in Romania a few years ago, but this is the community water supply. This is a well that has a, you can see the bucket that's suspended down into the well. It's a shallow well. It's got microbial contamination. On the other side of that picture is actually a farm that has horses, so you probably have nitrate contribution. And because it's a shallow well, you probably have some metals. So while you and I can easily go turn on the tap for our water supply, the challenges globally are pretty amazing, like this well in this picture. But let's go to the next slide where it's even more of a challenge. This is the community water supply outside of Accra in Ghana. This is up in a place called Kumasi. So it's several kilometers outside of the capital city. But this is the community water supply. And as you look deep into the picture, you can see little kids who are swimming and playing and bathing and probably using this water supply as a toilet. But look up in the far left and you'll see ladies that are getting water to bring home for domestic use. And if you look on the right upper side of the slide, you'll see the ladies that are using the water supply to do laundry. So this is the community water supply. This is where people bathe and go to the toilet and get drinking water and also have water for washing and domestic use. I also put this picture in to remind me to tell you a little bit about risk in perspective with environmental health challenges. I gave a talk a few years ago at the University of Ghana in Accra, and my talk was on 1 in a million risk assessment. As you know, the standard for risk assessment in the United States and other developing countries is that we'll accept one adverse outcome in every million events, or 10 to the minus 6. Those of you that took risk assessment know that number real well. Sometimes we call that acceptable risk. Sometimes we call it de minimis risk. But whatever we call it, it's sort of the standard that we have. And so after completing this talk in Accra on 1 in a million risk and risk assessment standards, I asked for any questions. And as I presented the talk, I watched a young woman in the back of the room who just didn't sit still through the entire talk. She was clearly agitated. And I asked if there were any questions, and before I could finish that sentence, her hand shot up, and out she shot from the chair and started to scold me and said, "Dr. Robson, thank you for that interesting presentation. I am a physician and a pediatrician outside of the capital city, and where I practice, 1 in 5 children will die of diarrheal disease before they're 8 years old. And 1 in 5 children will die of malaria before they're 8 years old. That's 2 in 5 children, Dr. Robson, or that's 4 in 10, or that's 400,000 in a million. That's a real risk number. Your suggestion about 1 in a million risk is so irrelevant, so impertinent, so abstract to me. I don't know why you came to give this talk." And so one of the things that Dr. Passesi and I talked about a little bit when we were preparing for the webinar today is how important it is to make environmental occupational health relevant. And so this slide gives me an opportunity to remind you, as you think about this as a possible career or to expand your career, is that the exciting thing about environmental health is that you can make a difference, and that there are real numbers associated with the people that are affected by these environmental exposures. 1 in a million risk is awfully hard for me to understand too, and I bet a lot of people who are on our phone call or on the webinar today. But 2 in 5 is a pretty straightforward number, and that's 400,000 in a million. That's a very straightforward number, and so I want you to keep that in mind. So let's look at another water example if we can go to the next picture. This is kind of an interesting study, and this will talk a little bit about real environmental exposures and what that means. we were able to do a study with our colleagues in Thailand, in the south of Thailand, to look at arsenic levels. And some of you know there are lots of good schools of public health doing arsenic work. Probably the leaders are Dr. Joe Graziano and his group at Columbia. But there are lots of people that have looked at this challenge. And so this is a little study that we did. And the blue dot is a home without any well. The yellow dot is a home that has 200 parts per billion or less. The red dot is a home that has 200 parts per billion or more of arsenic. And some of those red dots actually represent as much as 1,000 parts per billion. Keep in mind that World Health Organization standard for arsenic is 10 parts per billion. And the New Jersey standard, just in case we have any New Jersey listeners on the webinar, is 3 parts per billion. The important thing to remember is look at the distribution here of those red and yellow dots. Pretty high levels of arsenic. And these are as a result of, these are shallow wells dug by hand, and these are the drinking water supply. So let's go to the next slide. And what we start to see in folks who have high levels of arsenic exposure, first this is stippling of the pigment. This is in Thailand. So people in southern Thailand have more melanin. They're more darkly complected than folks who would be from northern Europe or from Caucasian people from the United States. So these southern Thai people have a little darker skin. And you can start to see, if you look carefully into the slide, the stippling. Interestingly, Thai people have a little expression where they call this raindrops in the sand, but you can start to see the stippling. It's the beginning of evidence of high levels of arsenic exposure. And let's go to the next slide, where we have an even more vivid example of arsenic exposure, the palmar-planar keratotic lesions. These lesions on the heel here or on the person's palms, these raised keratotic lesions are clearly a very common exposure to arsenic. And so let's go to the next slide. And so it's fine to go measure things and say, wow, we have high levels of arsenic. It's fine to go take pictures of folks who have evidenced the exposure, as long as you do it respectfully and for the right reasons. But it's more important to solve the problem, and that's what we try to do in environmental occupational health. So this is a study where, with some help from the Japanese government, these communities were able to have deeper well sources, deeper water sources dug, and this little boy is taking a bath, as he would call it. I was in that village for a week. I took my bath there, too. I have to tell you, it was the coldest water. And it's fine, I guess, if you're about 5 or 6 like he is. When you're closer to 60, it's not so much fun. But this is a way to do some remediation. I gave this talk a few years ago and used some of these pictures to our medical residents. And one of the young physicians in the audience said, well, Dr. Robson, I can't imagine why this wasn't done sooner. And I said, well, doctor, let me tell you why. These are poor rural communities with much infrastructure. You can see this is the bathroom from this home, and you can see right out the door. It's basically, we're going into the jungle here. It's the rural parts of Thailand, lots of vegetation. And in fact, a shallow well with a couple of shovels, 2 or 3 of us could dig a well in less than a day and have pretty good looking water, and water that doesn't taste too bad. So I reminded the young physician that it wasn't about the digging the well by hand. It was the deep well that was a couple 100 feet deep that needed to go further down into the water table, into another water table, to get water that would be without arsenic. The arsenic phenomenon is very often associated with a shallow water source. And so here we have deep well and deep water, but it was very expensive. So sometimes you can identify the problem fairly quickly in environmental health science, and it's pretty straightforward. It's the solving of the problem or the remediation of the problem that gets to be such a challenge, and to get people to adapt to that. Remember, I said we're going to spend a little time on water, so let's go to the next slide and sort of transition from water used for domestic use, like bathing or drinking, to water used in agriculture. Irrigated agriculture, which is so important in most parts of the world, is really a large consumer of water. Now, this is one of my favorite pictures in my collection, and I have to admit to you that one of my students took this picture. I didn't take it. He's a better photographer. But this is a rice plantation up in the north of Thailand, and I think the picture demonstrates so well the importance of water in environmental health and public health. This is how we irrigate the rice. This is how we grow the rice nursery. We flood the rice paddies to have adequate water for the rice fields. But this is also the same bodies of water where the local fish are grown. This is the same body of water where people are going to go ahead and remove water for domestic use and for bathing. So water is one of those things that truly impacts all of our systems, not just the water that we need to drink, not just the water we need to bathe, but the water we need to produce our food. So let's talk a little more about food and go to the next slide. We consider food safety, and residues on food, contaminants on food, all part of environmental health. And probably one of the foods that gets the most attention on a regular basis, of course, are apples, going way back to a public health crisis a few years ago when we looked at apples and the compound called alar, or nimidazide. Alar was a product used on apples to keep them more crisp when they stayed in storage, and for apples that were red to make them look more red, and finally to keep them on the trees longer until the farmer was ready to harvest them. The important part for you and I is, where do apples fit in as far as our diet, and part of who is most at risk. And so if we go to the next slide, we appreciate the fact this is a graphic from the NRDC that appeared in all the major newspapers. I photographed this one from my New York Times, but it appeared in the Boston Globe and the San Francisco Chronicle, and all the major newspapers in all our larger urban areas across the United States. What they were trying to do, of course, was to demonstrate the risk associated with each of the pesticides that are listed under the apple, and of course the more the apple is consumed, the greater amount that we're exposed. Now this was important because when we do good environmental health, we just don't look at what the risk is, but the actual population, the affected population. And in a little bit, Dr. Bassesi is going to talk specifically about vulnerable or at-risk populations. But one of the things we learned from the alar example was that the initial risk assessments weren't done properly. They did the risk assessment on an adult. And some of you who have children that are on the webinar realize that when our children are growing, they usually go with either mom's milk or formula. And then as they start to grow, they switch to apple juice. So if you do the risk assessment on me as a 60-year-old white male, chances are good that my apple juice consumption is pretty close to zero, or maybe it's just very occasionally. But if you look at the risk assessment, and remember risk is all about dose, milligrams per kilogram, and that's a function of how big you are, the kilogram part of the equation, the rate or the dose is actually quite high based on how much apple juice a young child consumes. So environmental health helps us not just only understand those pollutants that are there in the water and in the soil and the air, but also in the things that we consume every day as food. Let's look at the next slide. So we can go, there we go, thank you. So when we look at the next slide, we also have the opportunity to see the different kinds of food that make its way into the marketplace. One of the important things is that in most commerce, it's not just food that we consume that's fairly close to home. I'm in New Jersey talking to you today. We're the Garden State, so between May through October, we have lots of local produce. Those of you listening on the call who are out in California, of course, you have a full season. But the rest of the time, we have quite a bit of food that is brought to us from around the world. And so in addition to the risks that we might have in domestically produced food, we also have concern about what's used around the world and how that makes its way through export into our market, what the pesticide residues are. Rachel Carson in 1962 through the publication of her famous book, Silent Spring, and I always tease my colleagues in the other public health disciplines and say, I don't think any of you have a book as exciting as we do in environmental health with Silent Spring, which really started the environmental movement. But while those pesticides that Dr. Carson talked about in her book aren't used in the United States, and most of them were banned in the 70s, many of them are still used in abundance in other parts of the world, particularly the developing world. So it's just not about the food we eat for breakfast that's prepared or the food we eat for dinner. It's about the food in the entire food system. Next slide. And so with that in mind, we also need to know how much we consume. When we want to do an accurate or adequate kind of a dose assessment, we really need to ask people what they eat. Now, I put this picture in to remind me to talk about this topic. This is a picture from a study that we published in Human Ecological Risk Assessment about food consumption. In this particular case, this is in Thailand again, and we had people in those canals where the rice paddies, where these fish were harvested. It's more than just a rice growing area. It also, the fish that come from those fields become an important protein source. And one of the things we realized is we didn't have any good reference doses. We had to collect our own data for what people consume, what they catch, and what they eat, so that we could accurately and adequately assess that dose. So part of what's exciting about environmental occupational health is not just what those pollutants are in air, water, soil, and food, but how they come together, what people eat, what's in the food, what's an accurate assessment for dietary contribution. It's interesting that we followed 54 families for a period of several weeks and had them, and they were very, very fastidious about helping us measure things. You and I can go to the EPA Factors Handbook, Exposure Factors Handbook, and see how much of a particular food a particular group of people might consume. A white male, 25, how many liters of water. An African American woman, 65, how many liters of water they consume a day. Those sorts of things. But in the developing countries, we really had to go out and get some primary data. So as I turn you back to Dr. Bessesi, I just wanted to say that what we find exciting about environmental health is the local nature of it and the global nature, that you can take what you learned in your School of Public Health when you got your MPH, PhD, or DRPH, and you can carry that either at a local level, or if you mature in your career or decide to even enter foreign service early in your career, the opportunities and the challenges are just as great there. Next slide.
So I'll briefly conclude our formal presentation with just 4 slides remaining. And so again, the profession of environmental health science, while it addresses exposures and risks to all humans, all populations in general, it also recognizes that some sectors of the human population may be at greater risk when exposed. And so Dr. Robson just alluded to this with the example of air exposure in apples and apple juice. And so children's health, and there's much work going on right now from the stage of perinatal development through childhood, levels of exposure, types of exposures, and of course what are the various impacts and suggestive data relative to various cancers or neurologic impacts. And this is certainly a major area of study and application of environmental health science. Next slide, please. And so environmental health science includes this concept of exposure assessment, and this slide just represents various tools. And we presented very briefly 3 major matrices: air, water, and food. But soil is a 4th matrix, and various instruments are available to collect samples and then conduct laboratory analyses, so we can answer the questions of what is present within a given matrix and how much. Next slide, please. And so in summary, we are characterizing the various matrices, the 4 matrices that are represented here. And then final slide, please. If you look at exposure assessment as being a major function, certainly not the only function, but a major function of environmental health science, you see that that is a component, and it's based on collecting actual primary data with instrumentation, characterizing the major matrices to determine the amount and the profile of what's present, and also in alignment with epidemiological surveys. And these data help provide a more comprehensive assessment of exposure, and that combined with the other phases of risk assessment help us estimate the potential impact that can result from various exposures. So that's it for our presentation.
Thank you, Dr. Robson and Dr. Basessi. Looks like we have about 5 minutes left in the hour, and we're going to take this time to address the questions that have been submitted over the chat box or the question box. Tucker?
Great. So the first question is, would industrial hygiene workers be people who collaborate with nurses to prevent nosocomial or hospital-acquired infections?
What was the first part of that, please?
Would industrial hygiene workers be people who collaborate with nurses?
Yes, I got it. So yes, absolutely. The hospital environment, healthcare environments in general, you have various types of scientists involved with that, but clearly this is an area where environmental health specialists or scientists, including an industrial hygienist, and many times specifically an industrial hygienist, would be involved with sample collection and characterization. So, for example, air sampling and surface sampling, just to name two. Absolutely, yes.
Great. The second question is, what do you see as the biggest environmental and/or occupational health threat in the next 5 years?
Dr. Robson, do you want to address that? I have an opinion, but...
Well, I'll go first, and both Dr. Basessi and I will do that. For me, working in developing countries, I see very quickly two parts to this. The first part of this is this quest. Remember I mentioned before that we have 7 billion people, we're heading towards 9 billion. We have to feed more people. We're not growing enough food. And you look at populations, China has a fifth of the world's population as an example, and only 7% of the tillable land to grow things on. So we have to grow more food. That means we have more agricultural inputs. So in developing countries, I think one of the great risks is this very rapid use, rush to use agricultural chemicals, which is fine, to grow more food, but without the proper care and guidance and product stewardship. So what I see in my work in developing countries is that we rush to use the technology without the necessary training and guidance and precautions in place. And so that's what I think is one of the big ones. Dr. Basessi, what about you?
Yeah, so I agree, but I'm not convinced there's just one area, and I tend to approach my science from a very integrated approach, so I'll give you a vaguer answer. And that is, for improved food quality, and defining food quality is not only the nutritious basis of the food, but the amount of food and the access to that food. You need high-quality soil, you need high-quality water for irrigation, and you need high-quality air so you minimize contamination. So the challenge really is an integrated approach. In some areas now, what you're seeing in these developing countries, most of my work is in East Africa. The water is a very obvious one. Access to food is another one. But the more insidious to them, I think, and perhaps more obvious to those of us who are used to cleaner air, is a very poor air quality, as these underdeveloped areas are experiencing increased transportation and even industrialization. So I don't think there's one answer to it. I think it's really an integration of several issues simultaneously. That's my thought.
Great, thank you. The next question is, are there concentrations or tracks within environmental and occupational health at the master's level?
Sure. I think, and it's very school dependent. All schools of public health, to be accredited, have the 5 basic areas that we all represent in the 50-plus schools. Some of our larger schools have some very specific kinds of things, like industrial hygiene. Industrial hygiene is part of the curriculum for environmental health. In some schools, it is, in fact, a very large specialty with additional coursework in measurement and assessment. Risk assessment is another one of those. Occupational health as a separate discipline as opposed to just ENOH. We have a number of them. We also have sometimes a specialty in global health that will have an environmental focus, as well as maternal and child health with a global focus as well as an environmental focus. So the beauty of public health, and specifically environmental health, is that we have resident in a number of our schools these specialty areas, so somebody can really thrive even at the master's level and get this additional training.
Yeah, well said. I totally agree. Nothing to add.
Great, and I think we have time for one more question. So the last one will be, what would you advise for someone who does not have a hard science background but is interested in getting an MPH and working in environmental and occupational health?
Michael, you go first, and then I have a really good answer.
Sure. You know, there are various opinions on that, not to get off on a track, but even for medicine now, the traditional pre-med track, there's increased flexibility, in fact, desirability for having a broader background than beyond the basic sciences or fundamental sciences. But having said that, I think the best thing you can do is supplement any undergrad work you have with some key sciences, such as chemistry and certainly biology and so forth. And I don't get locked into so much of how many credits of that, but taking enough that you feel a certain level of competence that you will be well prepared. You'll have a strong enough foundation for environmental health science. And it varies by some programs. I know this is a philosophical question, and many universities address this differently, but my own personal opinion is that it's a much more rewarding experience if you have at least some foundation in the biological and chemical sciences, and taken either prior to or in some cases concurrent with the master's level curriculum.
And I'm a big believer in environmental health is a big enough tent that we can fit lots of folks. And I'll quickly tell you one of my favorite little stories that way. I had a student come to me a few years back, and she had a bachelor's degree from the University of Massachusetts in Italian. And she goes, Dr. Robson, I want to get an MPH. And I knew her mom, who was trained as a public health person, and I assumed that she would go into health education like her mom. She goes, no. She goes, I want to do environmental health. So we looked at her transcript, which had very good grades, but all in social sciences, and I think something like 42 credits in Italian literature and Italian language and things. And you know, she graduated with a 3.98 in environmental health. She took toxicology, she took risk assessment, she took ecotox, she took them all. And I think if you're motivated and you're energized and you really want to do it, you can do it. And she even won an award from our New Jersey Association of Industrial Hygienists. So my counsel to people is, based on that question, certainly, as Dr. Bessesi points out, it's really good to have that foundation. You have to do a lot of self-training and or take some remedial courses if you feel more comfortable doing that. But I think the nice thing is environmental health is a big enough tent that you can find a place in there. Clearly, you know, if you go to a place that has a very strong quantitative risk assessment program like either Hopkins or Harvard, where they teach several courses in risk assessment, they're highly quantitative. You need to have those math skills to be able and understand the chemistry to be able to effectively master the courses at the same time. And you can do that and get a spectacular education at those places. But I think there's a broad enough interest in environmental health that you can, if you didn't get all A's in chemistry in high school, because this is a graduate opportunity, this is a new idea, this is a new opportunity to go forward, and don't let that drag you back.
And I would agree with what was just said. I think one of the differences is that high school, many of those sciences are the basic sciences. Environmental health is an applied science where it applies those, so I would agree.
All right. Well, thank you all for joining us today. Unfortunately, we've reached the end of our hour, and I want to say thank you to our speakers, Dr. Robson and Dr. Bessesi, for such an insightful presentation. I think you definitely piqued some interest today. Please be sure to contact us with any additional questions, and stay tuned for future ASPPH Discover Public Health webinars by following ASPPH on Facebook and subscribing to the Friday letter.